Okay, now we start the second part of the relaxation. We have worked until the sacroiliacal joint and the sacrum and the coccyx, and we want to see the connection of the bones and the muscles in this area. So we start with the 12th rib. Do you have some pain here?
Only a little. There are more.
There are more. And what do you prefer? This direction or this direction?
The first one.
So this rib wants to go outward. I want to check your pelvis too. Do you prefer this direction or this one?
First one.
Okay, this left side wants to go anterior, the right side anterior or posterior?
Anterior.
So both want to go anterior. So we have not yet worked on this area with you, so we have to do that now. We start with pushing both iliums anterior. How do you feel with that?
Fine.
Okay. And the second part, we slowly loosen our weight because the bones want to come back. We push them downward and then we feel now they want to come back, and so we loosen our grip and just accompany the movement which is going backward. Okay, and then we test the sacrum. Do you prefer this direction or this one?
Down.
Downward. So we have this one, both bones want to go a little further and this one downward. But I want to check also your calves. Is it painful here?
No.
No change? Okay. So this one downward, this one forward. How do you feel?
Absolutely fine.
Fine. Okay, and we check also his position on the left downward or right downward?
Right downward.
Right downward, okay. And we can also test the turning to the right or to the left.
To the left.
So we turn to the left, sink to the right and downward. And hold both iliums in the anterior position. Now the movement starts on below my hand, and I just accompany this movement. These are the orthobinomic techniques to relax the lower back. And we are now in phase 5, which are just accompanying the movement of the fascia in the body, very softly and empathic. Okay, and then we shake the spine a little further, and now we go to the ribs once more. So you said on the right side it's little tension.
It changed. It's on the left side.
Now it's on the left side. Okay, what do you prefer? Downward or backward?
Backward.
Okay, so the system has changed now. Prefers backward, and now I relax the quadratus lumborum muscle, which starts at the 12th rib, goes to the pelvis. You feel good?
Yes.
And the quadratus lumborum muscle is also one of the main sources of low back pain. And this way I can relax it by pushing together. Okay, you're fine?
Yes.
You have some pain here too?
A little, yes.
What do you prefer, backward or downward?
Downward.
It's okay like this? Or do you prefer this one?
This one.
Mm. You can try both directions if you're not very sure. Okay, and then we go downward. We check all the different levels of this lumbar spine. Do you have some pain here?
No.
If you had some pain, this is
There, yes.
here is some pain. So, do you have less pain now?
Mm-hmm.
So, if this would give a relaxation, that would be the fifth vertebra, but it doesn't give a relaxation, so it's probably the sacroiliacal joint. It's better now?
Yes.
So we just hold a little, the sacroiliacal joint a little more. It's okay?
Mm-hmm.
And you have some pain here? In the level of the hip, of the pelvic?
There, yes.
There's some pain, and so we are on the fourth vertebra. You have less pain now?
Mm-hmm.
And just we lift the pelvis to this point. We don't need to pressure, we just touch the bone and feel the reaction of the joint. And our own system is connected with his, so I feel my deep breath, which shows that he is okay now. Is okay?
Mm-hmm.
And the next one, you have some pain here?
No. Yes.
Okay, better now?
Yes.
Okay. And now we would do that on the same procedure on the right side. Now we go to the gluteal areas. We have some pain here?
Only a little.
Do you feel better now?
Mm-hmm.
So there's some tension on the ligaments which connect this sacrum with the hip joint. We just lift the opposite part of the pelvis. It's okay?
Mm-hmm.
And you have some pain here?
No.
If he had some pain here on the piriformis, we would ask if he feels better this way or this way. And then we would just press the hip bone to the coccyx until the piriformis lets loose. And for the upper spine, it's the same way. We just watch where is some pain and lift the shoulder. Is it better now?
Mm-hmm.
So we go all these small joints which are beside the spine, and we lift the shoulder to the points of the upper spine, and we lift the pelvis to the points on the lower spine. Some more pain in here.
Mm-hmm.
And for each point we have to lift a little further. And wait. Okay?
For me, it's
Here's some
feeling.
tension here.
It's over there. It's the
Yes.
most pain.
It starts here. This
Everything you're doing, I'm feeling here.
Mm-hmm. There's still some tension in this area. You want to see where it starts.
Mm.
Okay, and the middle part we can often relax by lifting the opposite ribs. Is it better now?
Mm.
Okay, so we would do that for all these joints, also on the other side. Some pain here?
No.
Okay, no, turn please on your back. pain here.
Mm.
We see where is the pain on the joint, and we turn the head to this direction. Is it better now?
Mm.
Now?
Mm.
Okay. You find the exact degree of rotation and rotate the head towards the painful joint for the middle part of this neck. Okay, now you watch the upper joints. Which part is more painful, left or right?
Left.
And that's the atlas, which has a connection to the bones here by the sternocleidomastoideus, which starts from here. Do you have some pain here?
Mm.
More on the left side? On
Similar.
Similar. Okay, so we have both muscles which are the tension. And we have a very, very slight movement of the atlas to the right, and which is usually connected with some tension in the ribs. We want to check which one is most painful. This is the second rib, third one, fourth one. Which is more painful?
Third one.
Third one, okay. So I put my finger here. Can you come upward? No, a little sitting, in a sitting position, just for the camera to see my finger. And you lay down again. So my finger is at the beginning of the third rib. My other finger is at the end of the third rib, where it starts at the sternum, comes to the sternum. And do you feel less pain now here? And I just hold the rib between my fingers, very softly. This is one main storage point for emotions. We often store emotions either in the sacroiliacal joint, in the sacrum, or in the third rib, or in the atlas, third or fourth rib, mostly on the right side. And just holding the rib opens the storage. And the stomach is starting to work. Intestinal reaction is always a sign of the vagus relief. And as I'm connected with him, also my breath is getting deeper. And somehow you can also often feel what kind of emotions are stored inside. Come in this atmosphere, maybe of a certain age, or a certain atmosphere, or something, or persons which are connected with this pain. You can also store the pain of other people, of our parents, or of our children, but it's not so strong now, but something like a melody from far away, which reminds to a certain situation, and you just hold the fingers so the body feels very secure, and wait if the body is ready to open the door to these old fixed emotions. There's a movement between my two fingers. Just hold it until this movement gets to a rest. And then I push my finger, which is backward, a little further outward to the second joint of the rib, and hold now the second joint of the back rib with the finger upward. Okay. Is it okay now?
Yes, it's okay.
And I want to see how the position now is of the atlas. No, it isn't anymore rotated to the right. And how's the pain here?
Much better.
Okay. And how is the pain here? Still little on the
Still a
left.
little there, but it's better.
Okay, you lift your head, please. And now we go to the relaxation of the sternocleidomastoideus. You hold our finger here and then turn softly the head so that the left ear comes closer to my thumb. Is it better now?
Mm-hmm.
And what do you prefer, if I push the sternum upward or downward?
Downward.
Okay, now hold the sternum downward. And you can do it yourself too. You can push your hand, the other one too, just in the small area of the sternum, not too bright, only 2 centimeters, 3 centimeters, and it's like pushing down into the stomach. Okay, just hold it. And as we had some storage of the rib, we want to check the heart region. If there's something fixed also in this area. You can imagine that you're pushing your hands downward into your stomach. And if this gives a relaxation, how do you feel?
Fine.
Okay, if this gives a relaxation, you just stay here. If not, we try the opposite direction. You can just try the opposite direction just to have a comparison. Just imagine that you're pushing it upward, your heart. Which direction is easier?
Downward.
Downward. So you go downward. Imagine that you push your hands inside your body. Go to the restriction of your heart until you reach the end. Okay. And now you let loose and watch if your heart is ready to open again and come back. And once it has come back, you can open your hands. And this is a very important zone which is connected with the atlas, with the jaw, with the head, with the eyes. So you always have to check these points. Better now?
Yes.
Okay. Now, watch atlas. There's still a little tension here. We go on the point where you can touch the atlas and move the head very slowly towards this point. It's okay now?
Mm-hmm.
Until we feel the relaxation under my finger. And we can add also the jaw to this procedure. How do you feel better? To the left side or to the right side?
Left side.
Okay, now we add a little movement of the jaw to the left, little movement of the head backward, and touch very softly the atlas behind the ear. And again, we watch if there are some emotions coming out which might have been stored here in this region. There's a different story which has been stored here. It is different places in our body for our different stories. We just watch them coming out of their hidden places. Okay. No, it's not bad to hold a little the arms in this position, just that the rest of the energy which has been stored can come out easier. Okay, you can sit up and just tell us what you felt.
There's less tension in my body, and it is a feeling that something left me. First of all, it was the feeling right here with the heart, the death of my mother, which was when I was 25 years old, and the second feeling was right here up there. What's leaving me is that I'm not enough. Everything I do is not enough for my father or someone else, or for myself. And that's slowly gone. And when I opened my arms, I felt that something was going into the room and out of my body. So that it opened. I felt that my arms would go like this more and more.
Good. Thank you very much.
I thank you.